So the first one is a 30-year-old woman. The reason for her visit is she's been getting semi-cyclical breast pain. And breast pain can be divided into two parts, cyclical and non-cyclical. She's getting semi-cyclical breast pain. There are no breast cancer risk factors that she complains about, or that she knows of, but she's worried. She's worried about the pain. Now, whenever a patient like this comes, whenever any patient comes, I think it's important, first of all, to take a very thorough history to understand exactly when the pain comes. Is the pain in one breast or both breasts? Are there, as the patient noticed, any associated lumps? And then proceed. The examination would be a thorough examination of the breast and the chest wall, and later on we can go over what is a proper examination that should be done by your family doctor or your gynecologist. And you told me it felt very good. Okay. All right. And then what investigations would you consider? Now, one of the things I need to say, before I examine a patient in a situation like that, I think that language is extremely powerful. And physicians have a tremendous amount of power in the language they use, and the way they use it and how they word things. When it comes to something like this, first of all, after taking the history and reassuring the patient, one of the things I will say to her is that there is a likelihood that I'm going to do an ultrasound on her breasts. I tell her this in advance because I'm concerned that if I tell her afterward, regardless of how I try to impress upon her that in fact I'm not worried, but I just want to be complete, I'm concerned that she'll go home thinking, aha, he found something, he's just not telling me. So I generally, after the examination, will do investigations which will be directed in part or in large part by what I found or didn't find. Usually an ultrasound in this age group, although it's important, I think, that if you're going to get breast examinations, especially in your 40s, I think you should include a mammogram and an ultrasound, because mammograms pick up things very different from ultrasounds. So I don't think you're getting a complete exam if you're premenopausal in particular, and all you're getting is a mammogram. And then the diagnosis would be mastalgia, which is a very medical way of saying just breast pain. And treatment, I'm going to let, we agree on this treatment we do the same, but I'm going to let Alvin talk about it.
Okay, what we'll do now is the patient has now gone to my office, and I've seen Yoel's history, and I do the same routine. Of course, it's always good to have a second opinion, and that's really what I'm there for, and the patient's already been given the feeling that everything's fine, except that maybe the patient is worried about cancer. Every woman in this room is worried about cancer. When you say the word cancer, you almost get a feeling in your gut of acid starts to secrete. Not one of us in this room will be unaffected by cancer, and some of us, as I have been, will be affected by breast cancer. So taking a history, the mother, the sister, is very important to find out if there's been a breast cancer history. But even if the patient hasn't had a history of breast cancer, they still worry about breast cancer. Pain means there is an imbalance in the body. The body is always about balance. It's always trying to get things back to level playing field. So if you have pain, you must understand that prostaglandin E2 is being secreted. Now, why do you need prostaglandin E2? Well, to tell your body, tell you that there's something wrong with it. In this case, there's distension of the areola and the lobular tissue of the breast. But for example, just right off the bat, off the top of my head, I would ask the patient their diet and make sure they're not having too much caffeine. Of course, that would be a cause of breast pain. That would be pretty obvious. And red meat and dairy contain a lot of estrogen, so I would get into their nutrition quite thoroughly. And in fact, what you're going to hear about is how important your liver and your GI tract is when it comes to breast pain, and I'll show you why. But when it comes to prostaglandin E2 causes pain, and we call it kind of the nasties in medical school, but we need prostaglandin E2 because that causes the contraction of the uterus, and none of us would be here without prostaglandin E2. But prostaglandin E1 is the body's way of bringing down prostaglandin E2. And how do you make prostaglandin E1? Well, you can make it yourself, or you can use supplements. For example, Evening of Primrose is a natural precursor directly to making prostaglandin E1. So that's why it's such a beautiful thing to use to prevent or treat breast pain. What you have to understand about estrogen is very complicated. Estrogen isn't one estrogen. Estrogen actually is 3 different estrogens. And estrogen is made up of a bad estrogen called estrone, a potent estrogen called estradiol, kind of the workhorse, and then the best estrogen, the forgotten estrogen, that's estriol. That's the hormone of pregnancy. That's the protective estrogen. We now know the earlier you have a pregnancy, the less likely you are to have breast cancer. We know that the body can take estrone and make it into estriol on its own, or the body can take estrone, make it over to estrone sulfate, and it can be a precursor for breast cancer. So we also have discovered through research that if you take indole-3-carbinol, which comes in cruciferous vegetables like broccoli and bok choy, indole-3-carbinol happens to be the very enzyme that is necessary to take estrone into estriol. So what could be better than eating vegetables to help prevent breast cancer? And a lot of supplements will help give you indole-3-carbinol. So the first thing you should understand is this is a bad estrogen, and we even check the blood levels for those levels, and that level will be high in some patients who are prone to breast cancer. The bowel and the gut and the liver, of course, are all connected. But estrogen has a very strange way of leaving the body. It either leaves through the urine or most commonly leaves through the bowel. And when you swallow estrogen, if you swallow it, goes to your stomach then sends it over to the liver. The liver then packages it up and sends it down the bile into the GI tract. And it packages it in little cellophane wrap packaging, glucuronidase. And it actually hopes that it gets to out of the body when a bowel movement is made. But if you have your bowel movement delayed, or if you're constipated, what will happen eventually is that estrogen will be reabsorbed through the bowel back into your system. So obviously, if you have regular bowel movements and more fiber, you're less likely to get breast cancer because you're going to have less estrogen absorbed through your body. Unhealthy bacteria attacks that cell membrane and will actually break the cell membrane that is attached to that cellophane membrane around the estrogen, and it will allow for the bacteria to let the estrogen seep through the walls and get back into the body. It's very strange that the body gets rid of it instead of, you think it would just go into the blood system. But actually the bowel needs to be healthy. If you have healthy bacteria, the healthy bacteria compete with the unhealthy bacteria and leave alone these little cell membranes of estrogen and allows the body to excrete. So obviously a healthy liver, anything you can take, milk thistle, dandelion, schisandra, vitamin D, all will give you a healthy liver. And in Chinese medicine, that's one of the first things they work on is your liver. And so a healthy liver and a healthy GI tract can give you less estrogen reabsorbed, can give you less breast pain. So obviously, here we are talking about breast pain, but I would also find out why the patient has a high estrogen and why they have estrogen dominance. And I would go through all the things that I could do to decrease that. We'll get a little bit more into that in a second. Let's go to the next case. I did mention that healthy bacteria, I suggested to you, like for example, flaxseed. If you take flax, it will actually break into healthy bacteria called enterolactins, enterodiols, which actually help to block the transformation of the bad estrogen. We'll go through this when we get to menopause. Things like flavonoids, stinging nettle, flaxseed. Just mention quickly that breast cancer, you can almost draw a line through the United States. The people above the line seem to get breast cancer more than the people below the line. We now know that if you slow down the metabolism of cells with vitamin D, you can actually decrease breast cancer, because we now know that vitamin D helps liver function, and slowing down metabolisms of cells gives you a chance to do proper metabolic turnover. If you speed up your cells, if you're excited, anxious, if you are stressed, you increase your risk of cancer.